I'm Dr. Narda Robinson, President, CEO, and founder of Curacor Vet and Curacor Med. And today we will be talking about the pharmacology of ginger and turmeric. Essentially, for turmeric, we're going to be talking about curcumin, which is the active ingredient in turmeric that has received the most research attention. But only about 2 to 3% of turmeric is curcumin. So we'll go back and forth with that terminology. Why I wanted to present this talk today is that when we look up the mechanisms of action and the applications of these two ginger type compounds, they can be kind of confusing and just very overlapping. So I wanted to put them more together side by side so that we could contrast and compare the mechanisms of action and indications, contraindications, and all that. And then once we're done with that, then we'll take a look at something like carprofen and see how that compares to these more herbal ingredients and where do we go from here. So, as I've said in past webinars about botanical compounds, I find the About Herbs app really helpful. And I do suggest that you have that downloaded on your mobile device if you are, talking to clients or interested for yourself in non-drug healing methods that may include botanicals. So this is from Memorial Sloan Kettering Cancer Center's more integrative medicine offering, and they keep the information fairly up to date. So I like it for that reason. It doesn't have everything, it's the big ones, but it doesn't have everything, and so that's why sometimes we have to go online shopping to PubMed.gov and look for the articles ourselves. So for today, as I said, we'll be focusing on the pharmacologic similarities and differences between ginger and turmeric, again, more curcumin. And what are the pharmacologic similarities and differences between these two herbs and NSAIDs, such as carprofen, which we might run across in the veterinary world? For the pharmacologic attributes, we're going to break that down into mechanisms of action, indications, contraindications, adverse effects, risks of interactions, and quality control concerns. Those are just, some of the basic need to know kinds of things when you're dealing with botanical remedies. Now, this is in contrast to when we've discussed Chinese herbs, where you don't really get anything of this. You just get some chi balancing and then some energy moving, which is essentially meaningless. But as we've reviewed before also with cannabis, but here expanding that to botanicals in general, we can think about the pharmaceuticals we're accustomed to being told about in veterinary or medical school, which are often including one main chemical that drives the reaction in the body. So for carprofen, it's carprofen synthesized in a laboratory typically has fairly predictable outcomes as long as the content, the constituents are consistent, and as long as it's free of contaminants, and as long as it's not counterfeit. We'll be talking a little bit about that later as well. For botanicals, that has many active ingredients, most of whom have not been tested and isolated and figured out what are they there for, what do they do? Are they a primary metabolite, which is mostly going to be responsible for that plant's activities of daily living, just surviving and growing and photosynthesizing and all that. But then you have your secondary metabolites, which are important for attracting, like insects or animals to help disseminate the seeds, or bitter alkaloids, perhaps, which are going to help fend off animals or insects that will want to consume them. So there's a lot of different chemicals, and they're not doing it for us, they're doing it for their own good. But this kind of coevolution that we have between animals and plants has it such that there's a lot of shared receptors and things that plants make that we respond to. But they're because of that, can be many variable effects. We have multiple constituents along with the chemicals. And then, depending on how these things are grown, they may contain toxins, adulterants, or contaminants. Toxins from the soil, perhaps, and adulterants like drugs that weren't disclosed on the label, or contaminants such as recent cannabis course, just the filth from the plant, the manufacturing plant, not the plant. Anyway, a lot of stuff can get in there along the way before it reaches your mouth or your dog's mouth. So those are just some of the considerations that we acknowledge when we're doing botanical medicine. So these are related compounds. Turmeric is a type of ginger plant, and on the top is ginger. And I have some fresh ginger right here, and you can tell when it's cut. Let me see. There's a cut surface. So it's yellowish inside. It's not very much in focus there, but yellowish inside versus the turmeric is more orangey when you look at it. And if that had some purposeful lead in it, which I can't say that it doesn't, but probably it doesn't. It's supposed to be organic. It could be even a brighter fluorescent yellow orange. And so when I show you something like this that was recently purchased at one of the major food more organic food purveyors, then how am I supposed to know where this was grown? Was it China? Was it India? Where was it grown? What How do I know for sure that it was organic, especially if it came from countries where you can bribe the officials? How do I know what the growing conditions were in terms of the non-heavy metal contamination of the soil? Because these are rhizomes, and they're just there, near the surface, and they're sucking in the water and whatever else is in the environment there. So I really don't know what the purity is of this. And thanks to knocking down regulations and no truth in labeling laws, or just the labeling of food. I mean, just the dysregulation of so much food and drug products, then that information is not available to me. And that should be concerning. But what are we going to do? I mean, we can get it out of a bottle and hope for more. Um, but did that company do its due diligence, et cetera? So when we have these sisters of ginger and turmeric, we can see that they are related botanically and evolutionarily, but they do have some differences in terms of their uses and interaction capacity and so on. So for this talk, I've used the About Herbs app fairly heavily later on, but I have accessed other sources too. So if we look back originally about where ginger came from, and that was Asia, just like turmeric. And historically, especially in India with Ayurvedic medicine, it was used quite a bit, as it says here, as a tonic for the memory and digestive system, the hepatic obstructions opener, an aphrodisiac, for expelling compact wind from the stomach and intestine, for diluting, desiccating, and getting emollient effects out of phlegmatic or phlegmy, and compact humor, or just solutions in the body that stick to the stomach, intestine, brain, and throat. According to the traditional literature, ginger is a vermifuge, so it gets rid of worms, and a remedy for paralysis and obstructive jaundice. So we can start to think, with even with this old type folk medicine language, what was it used for? So it had some anti-parasite effects, some neurologic recovery effects, maybe is that anti-inflammatory, neuroprotective, and so on. And then we have obstructive jaundice. So it's a cholagogue, or helps to stimulate secretions in the digestive tract, which include bile and pancreatic juices and salivary juices, etc. So then they say this phytomedicine also cures diarrhea due to corrupted food. So before refrigeration was around, they had to do something to help decontaminate their food, and when they would store it, things like ginger and cayenne pepper and just all these strong spices would help give antibacterial effects to the substrate. Also, the way that ginger helps with diarrhea is that it counters the enterotoxins from various food poisoning bacteria. Now, when we shift that and think more of the historical uses of turmeric, when used orally, it's been applied for indigestion. We don't have any of the flowery language for this, but indigestion, throat infections, metabolic dysfunction, the common cold, and pain and inflammation. And then topically, it would be used for antibacterial and antifungal effects for skin wounds. So I think of other botanical agents that have been used quite a bit throughout the years, and a lot of them have similar sounding applications, but that's just because there's so many chemicals in each plant, and pretty much all of them have antioxidant effects. So you're going to get some overlap. But that's why we can then look at, well, what's going on with each plant, and even two ginger type roots that we're going to be talking about. They're very similar, but they do have differences in terms of their more tested applications. So, indications and applications from the modern, more tested kind of scientific literature. So modern uses for ginger from the About Herbs app. So things that have shown to be valuable. It's not that they're not used for 100 different other things, but the things that poke through are appetite stimulation for gas and indigestion, diarrhea, nausea, and vomiting. So we see here a slew of digestive tract indications. Also for rheumatoid arthritis. So what would that be? That would be things like inflammation and pain, and maybe the neurologic windup that accompanies longstanding arthritic problems, respiratory ailments, and drug withdrawal symptoms. Now, here, something that wasn't mentioned in the About Herbs app is this clinical trial on the efficacy and safety of ginger in osteoarthritis patients, a meta analysis of randomized placebo controlled trials. And as they say in the article from 2015, Osteoarthritis and Cartilage, herbal remedies and other nutraceuticals are increasingly and extensively used by a substantial part of the population. Unfortunately, only few of the remedies have been tested for efficacy and safety in well designed clinical trials. And the American College of Rheumatology for therapies for this is osteoarthritis, it's not the rheumatoid arthritis like we saw in the About Herbs section. But for OA of the hand, hip, and knee, it's like, okay, our recommendations from this American College of Rheumatology, we'll think about what's the available evidence and how do we balance the pros and cons or benefits and harms of both non-pharmacologic and pharmacologic modalities. And that's where I see our doing integrative medicine is it's not that we are not using drugs and never doing a surgery, but we're seeing integrative medicine as first line approaches that can be considered and should be offered with the pros and cons acknowledged of each. So, anyhow, here then they go on, and in this meta analysis of ginger for osteoarthritis, they demonstrated that ginger did have a superior effect on OA pain and disability compared to placebo and without serious adverse events. And so this is important for this discipline because they don't want to just be relying on opioids and other problematic, NSAIDs and all that for patients that are going to be needing this for life. And then we can think about that for our veterinary patients as well. So that's a little something extra on ginger. Now, when we get to the indications for turmeric, from About Herbs where they're just taking the subset for which they've seen, enough, even the minimum requirement of what their standard is, but seeing that it's useful for cancer prevention, infections, inflammation, kidney stones, and stomach and intestinal gas. So we see here this kind of flatulent application is common to both. also inflammation issues are common to both. And then there's going to be the antioxidant and pro-apoptotic effects as well. So we looked at that other meta-analysis on ginger, and here was a study from Clinical Interventions in Aging from 2014, where they compared the efficacy and safety of curcuma domestica, which is turmeric, and extracts thereof, compared that with ibuprofen in patients with knee osteoarthritis, and it was a multi-center study. In this study, they had 367 primary knee osteoarthritis patients who had a pain score of 5 or more. And so they were sorted into groups. Either you'd get 1,200 milligrams of ibuprofen a day for 4 weeks, or more of a turmeric extract, 1,500 milligrams a day for 4 weeks. So, I mean, if I even took 200 milligrams of ibuprofen a day for 4 weeks, I wouldn't like that. That wouldn't be happy in my digestive tract. But I don't know that a turmeric extract would be either. Now, right away, even is too, in light of all the cannabis that we've talked about and that are all around us, when anybody says, "Oh, it's a hemp extract," then of course I want to say, "What do you mean it's a hemp extract?" Okay, you squished out some hemp and you say that there's 15 milligrams of hemp stuff in it. Same thing with turmeric. What exactly is that? And how much of that was curcumin? What was the other stuff? So that's a flaw in this study. But what they found was both group, subjects pretty much were compliant. They took what they were supposed to, at least they said they did. And in the outcomes, there were no significant differences. So patients' global assessment and satisfaction at week 4, same between groups. They were satisfied with the treatment, and two-thirds of them rated themselves as improved. So whether you took ibuprofen, which of course has potential negative, so the downsides, or turmeric, which actually, when you think about it, is going to have a lot of upsides, then if they're the same, then and if we could actually know what was in this curcuma domestica extract, insisting on a certificate of analysis or something like that, then why wouldn't you wanna go with turmeric? Because it has so many other beneficial effects, including the anti-cancer piece. So, that's the value of doing your online shopping on PubMed.gov and really exploring the literature because, from one day to the next, there might be a new study that is even more convincing on things or more illuminating about potential negative effects. So one of the processes that I've talked about in other topics and that comes up a lot here is the cell apoptosis. And more often than not, I hear it pronounced apoptosis because that's how it's spelled. Fortunately, in veterinary school, when I had a professor that talked about this, he knew that this is more from the Greek derivation, and the second P is silent. It's apoptosis. If you say apoptosis, it sounds like you don't know that it's not really apoptosis. It's apoptosis. So, anyway, cell apoptosis is a process of programmed cell destruction that occurs in multicellular organisms. And this diagram here, this illustration, shows how you start to get changes in cellular morphology. You get these blebs that form, and then the cell will just shrink and just die. And here is a more, all from Shutterstock, a more sequential, highly diagrammatic version and comparison of showing apoptosis. And first, you have the normal cell here, and then this formation of blebbing, as it says. So just it becomes irregular in shape and these little pockets, and the membrane becomes more porous, or just it's going to start leaking its contents. It eventually will break apart into several, they call apoptotic bodies, which are then phagocytosed, which means those macrophages are going to come back and gobble all that up, and then go their merry or doomed way in the lymphatic system. But there's not really any inflammation there. And that compares to what you see with necrosis, where it's just dying and it's more of a chaotic situation of cell death. It's not programmed cell death. But if we didn't have apoptosis in just normal development, we would end up with webbed fingers and toes. And some people are actually born that way because they didn't have apoptosis happen at the right places. So it's part of just survival and development and what should happen. But if you have a cell that went rogue and possibly has some DNA changes, this is how the body can address that and it has different maneuvers it'll do. Like it'll warn you and then it'll say, okay, we're gonna send some maybe reactive oxygen species your way. Those mitochondria are gonna rev up some defense mechanisms. And if you are beyond hope, you will be apoptoticized. And that's defense mechanisms for the cell that will help with tumor prevention and cancer surveillance. So when we start to look at um, the mechanisms by which ginger will work, for example, we have that antiemetic effect. So it treats nausea and vomiting or prevents it. A common application in the human is for early pregnancy nausea and vomiting. And because there has been some information about increasing uterine contractility with ginger, it's been unclear whether ginger would be really helpful in pregnancy without causing any negative effects. So I saw at least one study that said it's not a problem. But, most of you guys aren't human practitioners, so maybe it's not an issue. But it works as an anti-nauseant by stimulating the flow of saliva, bile, and gastric secretions, and competitively antagonizing the 5-HT3, those serotonin, that 3 type receptor, and also by stimulating antral contractions and accelerating gastric emptying. So it's helping just stop that just stuff in your stomach from staying there and helps to move it on. And that's why I can remember being at the airport one time and just realizing, yeah, I probably had something that wasn't sitting well, and I didn't wanna feel nauseous on the plane and all that. So, I called a friend and she reminded me because I was just in my state to go get some ginger ale, and I resisted getting the diet type, and that was it. That took care of it. So even ginger ale, make sure there's some ginger that can help you when you're in a distressful situation about to get on a plane. So other things, it has the anti-inflammatory effects such that if you remember the arachidonic acid pathway and then cyclooxygenase and inhibition of cyclooxygenase or the lipoxygenase, you're going to potentially inhibit thromboxane formation if you're going to inhibit some of those other enzymes, which means that you can start to have increased risks of bleeding. So with the anti-cancer effects of ginger, there's our apoptosis again. It helps also to reduce tumor growth by damaging the microtubules in the tumor and by inducing mitotic arrest, so it's not dividing so quickly. It increases levels of circulating antioxidant and phase 2 enzymes. And then there's just so many more pathways. So I encourage you to look in the About Herbs app and see all the different things that it does, because this is just a subset. So when we get to curcumin in comparison, we see here something that we didn't necessarily see with ginger in terms of the hepatoprotection. And this is probably more like humans get liver injury more, especially with having too much alcohol or different things. So it's going to protect the cells, prevent them from going down the pathway towards death. It's going to induce the MMP13 enzyme, so that's matrix metallopeptidase 13, and inhibit TGF alpha production. For anti-inflammatory effects, we did see those as well with ginger, but it's reducing tumor necrosis factor alpha, which is a key mediator in many inflammatory conditions. And there are also just a wide array of anti-proliferative and modulatory mechanisms that you would see in research or with About Herbs. For the anti-cancer, again, we're seeing that induces apoptosis when there's a cancer cell. So it's like helping the body identify rogue cells and cells where the DNA may have gone bad or something else might have happened. Anti-angiogenic, inhibiting tumor cell growth and downregulating cancer growth factors. So I just summed those up. But now what happens? Are there contraindications? So we saw earlier the indications or the purposes for it. Contraindications for ginger, it's just like if you need to not bleed, then don't take ginger because it can increase your risk of bleeding by inhibiting platelet aggregation and so on. You should avoid giving it to patients that have gallstones because it's stimulating that bile secretion. So, I mean, when do we know when a non-human has gallstones? Not that often you might run into it, but in those cases, that'd be a contraindication. The contraindications for curcumin are not that clear. I mean, curcumin is still going to have a lot of herb drug interactions, so that would be a deeper dive into when you shouldn't pile on the curcumin. Adverse reactions for both ginger and turmeric being related, but you can get heartburn or just some gastric distress, just a little bit doesn't sit that well if you take a lot of it, and maybe dermatitis if you rub it on your skin, and then that bleeding risk and maybe some GI discomfort for turmeric. But they are both fairly well tolerated. Now the thing is, even for carprofen, even for all these NSAIDs, they have their own host of interactions, drug-drug interactions. We're just going to today cover the herb-drug interactions with ginger and turmeric. And so we're going to have an additive increased risk of bleeding with the NSAIDs or other anti-inflammatory medications or herbs. Same thing if you're going to thin the blood yourself, and then there's going to be an additive effect with ginger. Ginger, like ginseng and cinnamon and a whole bunch of other herbs, can lower blood glucose, which in a way shows how if you're worried about getting diabetes mellitus, switch to a plant-based diet and you will be several steps ahead already. But there are increased reductions in blood glucose when you pile on the ginger. Tacrolimus with ginger, you might get increased plasma levels of tacrolimus. And on the other hand, especially with orally administered ginger and cyclosporin, you can get decreased blood concentrations of the cyclosporin. For curcumin, which I'm switching to instead of the turmeric, there are many. And so I even just copied some of the information from the About Herbs website. So I typically go to it with my computer and look, this is page one, and then this is page 1.5. So there's all these different potential interactions with turmeric or curcumin, things that might be important in the veterinary world. Turmeric inhibits doxorubicin induced apoptosis of breast cancer cell lines in vivo. So we do give doxorubicin. Cyclophosphamide inhibits the cyclophosphamide-induced tumor regression in animal studies. But you see here for almost all of these, clinical relevance is not known. There's the tacrolimus, we have ibuprofen, we have aspirin, back on the other page. Yeah, so there's just a lot of different interactions, and it's hard to know exactly which ones will be meaningful. But at least if you see changes in a state where an animal might have been well controlled on some level, then and they're not controlled anymore. Perhaps there was an interaction, but whose fault is it, this one or the other one? If the other one was just an only child, then there wasn't the risk, but then they get together and have combined risks. So quality control issues. For plants that we've discussed in the past, we've brought up the environmental contamination. And for example, with cannabis, it's a bioaccumulator. It will leach things, a lot of stuff from the soil. Turmeric can do the same, and ginger can do its same. It just matters where you're planted, what's going to be your water source, what kind of nutrients. I mean, that's what they do. They take in things from the environment. And if they live in lead-rich soil, they're going to get that. So, and we have a question. Let me see. So Deanna asked, when saying increased risk of bleeding, are you referring to risk of GI ulcers or GI bleeding, or just the tendency to bleed easier if there was an injury or trauma? Yeah, all of the above. So if we're thinking about using, let's say, a curcumin alone or curcumin mixed supplement for a dog with some kind of inflammatory disorder, the value of that is that it's not going to be like a pharmaceutical nonsteroidal anti-inflammatory drug or NSAID, where it's going to inhibit the COX-1 enzymes, which are more your constitutive prostaglandins that you need that give you the protective secretions of the stomach and so on. So when you're risking bleeding, it would be like if you were going in for surgery or dog had or someone hemangiosarcoma. So wherever there might be a broken barrier or erosion, then you've got ginger or turmeric on board, then it's thinning the blood more so. So before surgery, we probably want to stop it or at least know that that's there and know to expect it, but you just don't want oozing all over the place. And then if whatever you're predisposed to. Now in humans, it becomes a much bigger issue because humans tend to be more on warfarin or other anticoagulants. And so then it's a real heightened issue, but not always harmful. It's just if you fall down, you might bleed longer. I mean, unless you have a tumor that's eroding into blood vessel, and then it'll be even harder to stop. So it's not that you shouldn't use it, but we should always know what the risks are. But for sure, a, an anti-inflammatory, a pharmaceutical one, is going to have at least the same or more risk. And I think that that is under thought about. So good question. Thank you, as always, Deanna, for asking that. So anyway, so here we are in Leadland, and this was from 2019. So this was about a year ago. FDA discovered lead-contaminated turmeric powder. Imported spices continue to pose health risks for Americans, and this was more from the Bangladeshi type sources. But where are these things grown? They are grown in Southeast Asia and just other countries typically. So, why would there be lead around? Whether you are curcumin or you are ginger, what's happening? Well, now, especially if you're coming from China, but any of these developing countries that are making a whole bunch of stuff, lead from batteries, you have the mercury from thermometers, you have things from the fluorescent light bulbs, and just inadequate control over those gets into the groundwater, and just the soil. And so if there is agricultural, industry going around near there, then guess who's going to get that? And it's not that these farmers are using pesticides necessarily. So does it get found? Does this piece of ginger have something in it? And even if the grower was legitimately being organic, what was in the water. So there's all kinds of questions with our food, and lots of deregulation and not testing. So I've just found it most salient, I think, in fruit. And it seems to me like things like watermelon and grapes, they don't taste right anymore. Even a lot of times water chestnuts, but I think that, well, at least I worry about the metal from the can because a lot of times they taste metallic coming out of the can. But watermelon, with all that water it has absorbed from the environment, it just doesn't taste right most time. And I typically get organic. Same to some extent with cantaloupe, but grapes have often tasted really weird. And so things just aren't the same as they used to be, where you could get a good grape and it tasted like not giving you these second kind of thoughts like, "Is that right? I don't that tastes weird to me." So anyway, for example, with all the food that we get from China that may not be labeled, that is in your, blank foods, freezer that you go in and get your frozen vegetables, it might not say, probably doesn't, where it originated from. So if we're talking about China, China produces 45% of the world's 12 million tons of lead annually. And the waste from the lead, you see here on the left, lead, it's used in batteries and all kinds of different things that industry needs to produce, apparently. That waste contaminates irrigation water, which then goes directly into contaminating agricultural land. The other thing, as it gets to turmeric, is that since turmeric is just this hot spice item now because of all the proposed health benefits, there are growers that really want that to be a nice bright orange. And guess what makes that a brighter orange is lead. This was a nice article that I ran across from 2016 talking about damage and heavy metal pollution in China's farmlands. And remember, we're not only talking about food, but we're talking about all those TCM herbs that are plants and not tigers or rhinoceri. But the plants that are growing there, and here's an idyllic picture, but how much heavy metal pollution is there? Wastewater and waste products from mines, and China does a lot of mining because they have abundant mineral resources and reserves of minerals throughout the country. And this in the back is pure cadmium, almost like it's 99 point something percent pure cadmium, pretty little metal. But excessive reliance on chemical fertilizers and poor soil maintenance increases the risk of cadmium contamination in food. And again, you have herbs, foods, plants, roots growing in that stuff. It's gonna, grow where you're bloom where you're planted. Okay, fine. I'm gonna eat what's in the soil. That's cadmium and mercury and lead. So where does that cadmium come from? Well, Chinese agriculture uses 40% of the world's chemical fertilizers and produces 25% of the world's grain each year. And they're just driving that soil. And if they don't use that amount of chemical fertilizer, even though it's not that efficient, they can't sustain it. And we just had a course at our CuraCore Academy, and one of the students was talking about just even in this country, I mean, growing corn or growing catfish or anything, just the amount of chemicals and antibiotics that are just pummeling the food because just for getting the highest yield and not really worrying about the healthfulness of what they're doing. And so, can you get organic? Yes. If you get organic from China or possibly elsewhere, you can bribe the officials and get your organic certification there. So, do we go local? Do we grow our own? I mean, there are definite issues there, and that's what you run into when you're using botanicals. That said, what's the risk benefit ratio of using an herb that you do your best, or maybe you get a purified form and it's been processed so that only the good active constituents are out there, or let's say it's Colorado grown hemp and the Department of Agriculture in Colorado is doing a good job of supervising things. So there are ways to be smart about it, but it's that or maybe a pharmaceutical, and that's not the greatest trade-off either. And so we're going to look into that a little bit more as well. So how do the ginger sisters, turmeric and ginger, compare to an NSAID such as carprofen? So remember, we talked about words such as hepatoprotective, anti well, there was anti-apoptotic for the hepatoprotective, but then there's pro-apoptotic for cancer cells. So there's a differential there. There's anti-inflammatory, there's gastric protectant, different things that were fairly not bad to have, whether it was what your target application was or not. So here we have Rimadyl and the mechanisms of action, and it talks about the inhibition of the cyclooxygenase activity. And essentially, it's kind of sort of more COX-2 inhibition that provides more of the direct anti-inflammatory. So Rimadyl leaning towards a more of a COX-2 so that it doesn't inhibit the COX-1, which is going to reduce those protective mechanisms such as your stomach secretions. So trying to get away from stomach irritation is how Rimadyl tends to work, but still have its anti-inflammatory effects. And the value of something like carprofen is that you more or less know what you're going to get, and it has more or less predictable effects. And so if somebody is post-dental, post-surgery, whatever, you're not really waiting. It's like, okay, in the acute instance, maybe this is reasonable. But of course, as an integrative prima practitioner, you would say, okay, well, we have that, and then we have acupuncture, we have photomedicine. Maybe did we preload with a certain amount of acupuncture before anesthesia was induced, whatever it is. So there's all kinds of different things we can do. And then interestingly, according to the description, several studies have demonstrated that carprofen has modulatory effects on both humoral and cellular immune responses. Data also indicate that carprofen inhibits the production of osteoclast activating factor, as well as PGE1 and PGE2, by its inhibitory effects on prostaglandin biosynthesis. So I also, in my research for this talk, ran across some other things like a paper on carprofen for treatment of COVID, like, again, this modulating the inflammatory immune response is that aspect. I mean, it was from some more obscure journal, but it was interesting to see. And then we also know that there are non-cannabinoids that interface with the endocannabinoid system, and NSAIDs are doing that as well. So they're inhibiting not only the cyclooxygenase enzymes, but the enzymes fatty acid amide hydrolase FAH, FAAH, which is what breaks down anandamide, which is the bliss molecule, the endogenous endocannabinoid ligand that attaches to those same receptors that THC will respond to, the CB1 receptors. So NSAIDs help to reduce the breakdown of anandamide, so an endogenous cannabinoid, endocannabinoid. So that's kind of nice too. Just like ibuprofen, I've said in courses as well that when I have a headache to the degree that it's going to make me okay, I'm going to take an Advil. I've eaten the chocolate. I've had a lot of sugar. I've done what I can, gotten the massage, and there's still that residue that I want to get rid of. And if I go that way and take an ibuprofen, there's just something nice about it that is beyond anti-inflammatory effects. And I think that that's the endocannabinoid stimulation or inhibition of degradation. So anyway, so that's nice. But then you have the palatability of some of those chewable tablets. And so if dogs get that, severe adverse reactions are possible, and a couple $1,000s of vet bills and ICU. And so here, when we think of the adverse effects of turmeric, curcumin, or regular ginger, there wasn't really that much. It was maybe mild gastrointestinal side effects. But here for Rimadyl, and it's just like, little stomach, no, I'm not going to bleed out. I'm not going to die. But here, Rimadyl, like other drugs of its class, is not free from adverse reactions. Owners should be advised of the potential for adverse reactions and be informed of the clinical signs associated with drug intolerance. Adverse reactions may include decreased appetite, vomiting, diarrhea, dark or tarry stools, increased water consumption, increased urination, pale gums due to anemia, yellowing of gums, skin or white of the eye due to jaundice. Oh, yellowing of gums, skin, or white of the eye due to jaundice, lethargy, incoordination, seizures, or behavioral change. Yeah, that's not what we saw with ginger or turmeric. We actually saw anti-nausea and vomiting with ginger. None of this other stuff. Hepatoprotection, not hepatodestruction. And then they say in bold in the description, serious adverse reactions associated with this drug class can occur without warning and in rare situations result in death. I don't think anybody's died because of turmeric or ginger overdose. Okay, but wait, there's more. So when we're talking about pharmaceuticals, there are the One Health aspects, so environmental pollution. As it says here in this news article, with millions of painkillers circulating annually, health and environmental officials often encourage consumers to use pill drop-off locations to dispose of unwanted or leftover pills. However, contaminants of emerging concern continue to show up in water samples. On a national level, researchers from the EPA surveyed 50 large wastewater treatment plants in the US to determine whether they could find traces of 56 pharmaceuticals, drugs like oxycodone and hydrocodone, in the treated water. The survey, released in 2013, so before 2016, well before, when the EPA was still functional, they found low concentrations of these drugs in every water sample they tested. And I read other papers on this issue, and it's like you can't filter these things out. It just water filters typically don't work for this. And then there are counterfeit drugs. Here's a thing from a website, consumeraffairs.com. The FDA urges consumers to use caution when buying pet medicine online. So, a lot of people have been buying their medications like Rimadyl online to save money. The FDA is warning pet owners to be particularly cautious as they turn to online retailers for products and particularly medications. While some sites represent legitimate pharmacies, the agency says they have found others that sell unapproved pet drugs, expired drugs, counterfeit drugs and products, and dispense prescription drugs without requiring a prescription. According to the FDA, a major red flag to look for in online pharmacies is those that do not require a prescription from a veterinarian before filling an order for prescription drugs. The FDA is particularly concerned about two common prescription pet drugs sold on illegitimate sites: heartworm preventives such as HeartGuard, Trifexis, and Interceptor, and NSAIDs such as Rimadyl or Metacam. So there you go. Are people getting fake Rimadyl? And if so, what is in there? I mean, is it just flour or is there something worse? Is there something cheaper from whatever country they're coming from that even might work? Is it a fluorinated steroid? I mean, who even knows? So they're suggesting that if you go online, that the website should end in pharmacy because apparently there are some regulations about getting that URL. I did not check into that though, and it should require a veterinarian's prescription, not some on-staff veterinarian who says they're going to evaluate the animal based on a form that the client submits, and should be licensed by the state. But I mean, that takes a lot of time, and we're already tired. But anyway, yeah, it's an issue, and your clients need to know about it, and it is really important. Even so, even the drugs that you do stock in your cabinet as a veterinarian, from your pharmaceutical supply company, there are contaminants in those potentially because so many of those are made in Asia or have components that are made in Asia, and the FDA just can't keep track. Then here in 2017, there was this release from the Southern District of Texas. Printing and packaging CEO pleads guilty to trafficking in counterfeit labels and packaging. So, yes, this person counterfeit and trademarked Frontline Plus, and Mario veterinary products. And during the same period, Rodriguez also intentionally trafficked in counterfeit trademarked Rimadyl labels. So if you're going to fake a drug, I guess you got to fake the label as well. And some of them are, I mean, they look real because they've been professionally faked. So just note that, and then note on these other drugs that that has happened. Now that was several years ago, but I would say if your patients are not getting the results that you anticipate, what is going on with that drug? Or I guess if it's ivermectin, is the person stealing it and thinking they're going to avoid COVID? So what's the best way forward? So we've promoted the idea that we're going to evolve veterinary medicine forward, that we're not just going to reflexively rely on what our drugs and surgery oriented veterinary training may have led us to believe, but we recognize that there's more that we need to know, which is from the acupuncture, manual therapy, photomedicine, botanical medicine, and integrative rehab domains. So we're going to evolve. We're also going to be in touch with our clients quite a bit. I like to give them my cell phone number or email. I'd rather email them. We have the freedom to decide what type of practice that we want, and maybe that means going mobile, having a small storefront, whatever it is, that we are not under some corporate dictate. And that allows us to introduce the Ginger Sisters in our treatment sessions, and all the other wonderful botanicals as well, as part of a multimodal treatment plan that includes pharmaceuticals when needed. But if we know enough about safe botanicals and we've had a discussion with the client about what is known and what isn't known, then we can start to potentially wean them off of a pharmaceutical. And then wouldn't it be nicer if for life they are being maintained for their condition, if needed, on products that have intrinsic value for a number of systems? And then we could include which I would rather do is something non-pharmacologic, medical acupuncture, photomedicine, medical massage, and integrative rehab to just activate the patient's intrinsic capacity for self-healing. And that's all part of what goes into the PRIMA certification so that you can have that flexibility and understanding of all the different modalities and use them in the appropriate context, interfacing with drugs and surgery as needed. So I don't see any other questions there. I am very grateful that you've attended this, and I am happy to take any questions by email. It's narda@curacore.org, and we will see you next time. Thank you for being here.